Lithium. Lithium is the third element on the periodic table. Its symbol is Li, has an atomic mass of 6.941, and it is found in group 1 of the periodic table, making it an alkali metal. It was first discovered in 1817 by Johann August Arfvedson, who declared it a new element after being unable to account for 10% of the mass of a mineral called petalite, though it was first isolated by William Thomas Brandy and Sir Humphrey Davy in about a year later. Lithium is found in our everyday lives in products such as glass, ceramics, aluminum, Pyrex, grease, batteries, metals used in aerospace, and old TV tubes, though one part of our lives that it has come to impact massively is mental health. This all began with a certain psychiatrist named John Cade from Australia, who began his initial experimentation in Changi Prison in Singapore, where he was held by the Japanese as a prisoner of war during World War II. And here he noticed that some of his fellow inmates began to exhibit symptoms of certain diseases correlating to certain vitamin or nutritional deficiencies. And because of this, he connected this with bipolar disorder, or as it was known back then, manic depression. This led him to experiment on guinea pigs using the urine from manic patients along with lithium to test whether or not there were different toxins in the urine of these patients and whether lithium would be able to neutralize these toxins or cure the depressive disorders. And in this experimentation, he decided to use just pure lithium and found that the guinea pigs into which he injected lithium would become very calm immediately, though as this would later become known, this was likely simply due to lithium poisoning, as lethargy is a common sign of lithium overdose. So after Dr. Cade tested on guinea pigs, he began to test on himself to figure out a proper dosage that he could give to patients without it being toxic. And once he found this dosage, he headed to Bundoora Repatriation Hospital in Australia, where he had worked previously, and found a patient named Bill Brand, who had been a manic patient for many years at the hospital, and he began to administer lithium pills to him, and his condition improved immediately. He became almost an entirely functioning person and was able to eventually leave the hospital. However, a few years later, Bill Brand would end up dead due to lithium poisoning, due to the dosage being used being very close to a toxic dosage of lithium. And this would lead Dr. Cade to suspend his attempts at utilizing lithium as a medicinal treatment for bipolar disorder. However, many scientists would pick this back up years later, and nowadays lithium has become the primary way to treat bipolar disorder for millions around the world and is one of the World Health Organization's essential medicines.